Good morning. I am Dr. Sandeep Kadam, consultant interventional cardiologist working at Dr. Kadam Heart Clinic and Diagnostic Center, Baner, Pune. Today we will discuss about whether I need angiography or not and when to go for the angiography. Angiography, first we will see why we go for the angiography. So angiography is needed to detect the blockages in the heart. So for that purpose, first the screening tests are done. These are ECG, 2D echo, that is two-dimensional echocardiography, and treadmill test, that is TMT test. All these three tests together gives some idea about the heart. If these screening tests are positive or showing any abnormality, then your cardiologist may ask you to go for the angiography. Apart from these tests, the symptoms and signs are important. If a patient is having classical heart pain or classical heart attack pain, what is the classical heart attack pain? The pain which was never experienced in the life, first time. It is in the center of the chest or right side or left side, in the right arm or left arm, in the shoulder, in the back or in the jaw. So these are the sites where the heart attack pain can occur. So what are the echo test and stress test suggest? So echo test is which gives the anatomy of the heart, means pumping action of the heart. Is there any leakage in the wall? Is there any reduction in the pumping of the heart? It gives the lung pressures and other wall structure. If a person had a heart attack in the past, it gives some informations. In a treadmill test, we ask the patient to run on a treadmill and simultaneously ECG is taken. These tests suggest we observe the ECG, and if there are any changes in the ECG, we conclude it as a positive or negative test. Negative treadmill test means normal and positive treadmill test means abnormal. What treadmill test gives information? It gives the exercise capacity, it gives the blood supply to the heart during walking, the ECG changes, and your blood pressure during the exercise. So with this test we can come to the conclusion that there may be a blockages in your heart, but to finalize or to give a 100% accurate diagnosis, we need to go for the angiography. Angiography can be done with the two methods. It is with the invasive angiography, where you need to get admitted in a hospital for 6 to 8 hours, which can be done from the hand, which is a radial artery. We puncture the radial artery, or from the right groin or left groin, that is a femoral artery. And another method is CT angiography, which is done by the radiologist, and it is done in the CT scan department, where CT scan is done with the use of dye injections, and the coronary arteries are visualized and they are reconstructed, and according to that reportings are done. Both CT angiography and coronary angiography have some advantages and disadvantages. First we'll see for the CT angiography. CT angiography is not a 100% accurate test. It is a test for mainly for the exclusion. It is a reconstructed images, and it depends upon the anatomy of the coronaries, and we need to see the calcium score in the CT angiography. While in invasive angiography, we puncture the artery, we put a small catheter in the artery and inject a dye, and we see under the fluoroscopy. And this invasive angiography take 5 to 10 minutes overall period, and the CT angiography take 10 minutes. Both have a radiations, side effects like radiations, but the minimal radiation can be done with the use of minimal time, so that we can reduce the radiations. A person who is having say diabetes, hypertension, and having classical chest pain or stress test positive, it's always better to go ahead with the invasive angiography rather than a coronary CT angiography. Why? Because there are high likely chances of blockages in such kind of scenario. A patient who is a young patient, non-diabetic, no diabetes, no sugar, no blood pressure, and having chest pain which is not a classical pain, in that situations you can advise, or cardiologist may advise you a CT angio, where the possibility of getting a blockages is very less, so we need to exclude whether there are blockages or not. See, there is a difference between the CT angiography and coronary angiography, so one should look into these points and decide whether to go ahead with the invasive angiography and or CT angiography. Invasive angiography is for a patient whose possibility of getting blockages are very high. Go for the invasive angiography, and the person whose possibility of getting blockages are very low, then to exclude, go for the CT angiography. CT angiography is not the replacement of invasive coronary angiography. Thank you.